Like all medications, GLP-1s do have some side effects that can make them quite unpleasant to use. And in fact, around 60 to 80% of people using a GLP-1 medication will experience side effects. So that is more than half of you potentially watching this video. And side effects can be a large issue for many people, sometimes leading them to stopping the medication altogether. Now, most of the side effects that GLP-1s can cause, they can be managed with some strategies, and they do tend to improve the longer that you use the medication. The information in this video isn't going to help eliminate every single uncomfortable symptom, but it can hopefully help minimize them so that they aren't impacting on your daily life too much. Today I'll go through why exactly these side effects can happen, what you can do to give yourself some relief and ideally prevent them, and more importantly, how to know if you might need to pause using the GLP-1 and get a little bit of help. So let's go. Now, in order to manage side effects, it's helpful to understand why and how they can happen. Now, with GLP-1 medications, they don't just suppress your appetite, they do fundamentally change how your digestive system works. So let's go through what is going on in the body. Normally, when you eat food, it moves from your stomach to your small intestine in about 2 to 4 hours. And this process is called gastric emptying, and your body carefully controls this process through hormones and nerve signals. And one of the main ways that GLP-1 medications work is by really slowing down the emptying of your stomach. This means a few things, but mainly it means food will sit in your stomach for a much longer period of time. You will feel fuller faster and also for longer. Your stomach has to work harder to process the same amount of food, and ultimately the normal rhythm of the digestive process, it gets disrupted. And this is what leads to many of the side effects that these medications can cause, because when the stomach empties itself more slowly than usual, it leads to this sensation of food sitting or lingering in the stomach. And remember, this isn't quite normal for your body, and it can make you feel quite bloated, uncomfortable, or nauseous. You may even experience some reflux because this food that's sitting in the stomach has more time to actually move upward and irritate the esophagus. Now, in a very small group of people, this delayed or slowed down stomach emptying can lead to something called gastroparesis, which in quite literal terms means stomach paralysis. It does sound a bit scary, but what's happening here is that your stomach muscles stop contracting as they normally would to push food through. This gastroparesis is basically if stomach emptying slows down a bit too much, and it's a bit of an issue if this happens to you. You will need to stop the medication and see a doctor. But unfortunately, the symptoms of this are similar to what you feel anyway when taking a GLP-1, but they are on the more extreme side and more severe side. But I'm just going to put up the symptoms that you need to keep an eye out for with gastroparesis so that you know what to look for. This is one of the reasons that people tend to start, or they should start, on the lowest dose of a GLP-1 and then move up slowly to avoid this gastroparesis and also to prevent severe nausea. Now, the stomach is not the only part of your digestive system that GLP-1s can impact. Your intestines are also impacted too, which leads to a little bit of a different set of side effects that people can experience. So just like how GLP-1s slow down how quickly your stomach empties itself, they also slow down the movement of your entire digestive tract, and this will of course include your intestines. So this slower movement, it means that food and waste, they take longer to pass through your gut, and the longer it sits in your large intestines, specifically the colon, the more water will get absorbed from it. This makes your stools drier, harder, and more difficult to pass, and of course this can lead to constipation. On top of that, you end up eating less food when you're on a GLP-1, so you're actually getting less fiber and bulk, both of which are usually needed to keep things moving. And so you might end up going from daily bowel movements to movements every 2 to 3 days. So as you can see, nausea, bloating, and constipation tend to be the most common side effects that people experience when taking GLP-1s. And now you hopefully have a good idea of why that is. For most people, the first 2 weeks is actually when side effects are worse, and things will settle down around the 2 to 3 months of use. So what we're going to do is get into these 3 side effects a bit more specifically, and we're going to go with the most common side effect that most people experience, and that is nausea. The first thing that you do want to do is try and understand your pattern of nausea, and this is because there are actually a few different types. If you know when your nausea is worst or when it is being triggered, then you can actually target your strategies a bit more. So the first one I want to go through is injection-related nausea, and this is nausea that happens pretty soon after you inject the medication. It could be within a few minutes or maybe an hour or so later, but this nausea happens because the medication may be getting absorbed a bit too quickly, and this can happen if you inject in an area with quite a lot of blood flow, and it can cause a rapid increase in drug levels in the body, which triggers a bit of a stress response in your body, and part of that stress response is feeling nauseous. Alongside the nausea, you actually might get a little bit of lightheadedness and sweating. The good news is that this type of reaction, it doesn't last as long. Now, other types of nausea include meal-related nausea. This one is related to when you are eating and you may get triggered by certain foods. It's a bit different for every single person that's using a GLP-1. Morning nausea is often because you had an empty stomach overnight, because you will likely be eating less. And some people just have persistent background nausea that is just this constant low-level queasiness. And so the first thing is just to figure out which of these different types of nausea you are experiencing. So let's start with some strategies that could give you a little bit of immediate relief. There are some natural remedies that you can use which are useful for nausea. There's things like ginger or peppermint. Other things you can do though include getting some fresh air. So it's sometimes a good idea to just step outside and open a window, or open a window when nausea hits, and then do some deep, slow breaths through your nose. This can help calm and relax your stomach because it triggers the parasympathetic nervous system, which focuses on digestion. Now, some people do find that cold therapy can help. So if you've got a cold washcloth or something, or get some cold water, put it on your neck, it can provide some relief. I would also suggest making sure you are staying upright for 2 to 3 hours after you eat food. Don't go and sleep or lie down right after eating because that can bring on nausea. Gentle movement is also very helpful. So something like a slow walk, not intense exercise, only a slow walk when you're nauseous. So those are just some small things you can do for more immediate effects when you're getting nausea. If you have mild nausea in particular, the things that I just went through can be quite helpful. They are quite low level. But what I want to do is actually move on to more food related strategies because they form the bulk of what we can do about nausea. Now, there are actually certain foods that you should go to when you are feeling nauseous, and we call them brat foods. And these are bananas, rice, applesauce, and toast. The reason we go to these is because they are plain and easy to digest. They don't make your digestive system work too hard, and they are less likely to irritate things. Dry and bland foods like crackers, pretzels, and dry cereals are options too. But if you are looking for a bit of protein, eggs, chicken broth, and plain Greek yogurt can be options if you're able to keep those down or if they work. Give any of these a test first though, because it will depend on what you can tolerate. And like I keep saying, everyone is a bit different. What you do want to do though, when you are feeling nauseous, is avoid the following types of food. First is high fat. High fat foods slow down digestion even more, and they make the effect of GLP-1s more pronounced. So they will make things a little bit worse. Other things to avoid are very sweet foods, spicy or heavily seasoned foods, because these can irritate an already sensitive stomach, and large portions. This is because large portions can make you feel sick because, again, like I said, the medicine slows down gastric emptying. You will have a larger amount of food in your stomach sitting there for longer, and if you have a large meal, it just adds to the amount of food sitting there, can make you feel sick. Now, meal timing is also very important when it comes to nausea. I wouldn't suggest skipping meals if possible, and this is purely because having an empty stomach just makes things worse for nausea. What's a good idea is to try and have small and frequent meals every 2 to 3 hours rather than large meals throughout the day. A bedtime snack can also help prevent morning nausea because that empty stomach overnight can cause issues when you wake up. Now, one of the most important things that you need to address if you are experiencing nausea is hydration, especially if the nausea is causing vomiting. This is because you are losing electrolytes if you are vomiting or sweating. So a hydration drink like Hydrolyte here in Australia will be useful for restoring your electrolytes. Dehydration will make you feel worse, so make sure you are well hydrated, but make sure you are sipping any fluids slowly rather than having a very large amount of liquid all at once, because again, that will make you feel sick because your stomach is emptying less frequently. Now, on the screen right now, you should be seeing what I call red flag symptoms. If these are happening, the nausea is not what we consider normal, and you do need to talk to your doctor or a health professional about this. Let's move on to the next side effect that a lot of people experience, and that is bloating. So bloating can happen for a few reasons. When food is in your stomach and intestines for longer, it gives the bacteria in your gut more time to work on and ferment the food, and this actually produces more gas, which leads to bloating. GLP-1s can also alter your gut microbiome, and this can cause some digestive discomfort when it's happening because your body just isn't used to this. Now again, there are different types of bloating, and knowing which one is affecting you will help you choose the right strategy. So meal-related bloating, that happens right after eating, and this actually tends to resolve in a few hours after you've eaten your meal. Gas-related bloating is usually accompanied by flatulence and also cramping in your stomach. Upper abdominal bloating, you will feel more in your stomach area. It's going to feel like your stomach is very full. Some people do experience all-day bloating, and this is a constant feeling of fullness which can get quite uncomfortable. So if you are experiencing some bloating, I'll just give you a few tips for some immediate relief. Gentle movement can be very, very helpful. So something like a 10 to 15 minute walk, especially after you've eaten some food, can help gas move throughout your system. Abdominal massages can also help too. So if you do circular motions around your belly button, generally in a clockwise direction, that can also help gas to move along. Warm compresses or heat pads, also a good idea. Now, one thing to keep in mind is proper posture. That goes a long way. Make sure you're sitting up straight, because if you're slouching, this can compress your digestive organs, and that leads again to more discomfort. Deep breathing, I know I said this works for nausea, but it also works for bloating because again, it can help relax the digestive system, which helps to keep things moving along. Now, I did also mention peppermint tea when I talked about nausea, but this can help with bloating too. It's actually probably more effective for bloating, and this is because the way it works is to relax your intestinal muscle. So in terms of food-based strategies, it's actually quite similar to nausea. You want simple foods that your body can process easily and smaller portions of food too. Protein, you don't want to skip out on that, but you want to go for more easily digestible proteins, so eggs, fish, chicken, tofu. Now what I'm going to do is again go through some foods that can increase the amount of bloating that you experience. If you are experiencing bloating, avoid these temporarily. The key word here is temporarily. So the first is actually high fiber foods. Fiber is a good thing and you definitely need it in your diet, but if you are bloated, it can make things worse, especially things like beans, lentils, certain vegetables like broccoli, cauliflower, kale. They can be difficult to tolerate early on. By no means am I saying avoid fiber for the long term, but it's just if you are experiencing bloating, fiber can make things worse. The next is raw vegetables. These are harder to break down and digest, and so when you're trying to have vegetables, it could be a good idea to just make sure they're more properly cooked. Carbonated drinks are another thing. This is because bubbles from fizzy drinks like sparkling water, soft drinks, even kombucha, they increase the gas in your gut, so it is best to avoid those. The next is sweeteners. Things like sorbitol and xylitol, these are often found in sugar-free gums. They're also found in protein bars. They can ferment in your gut and cause, again, more gas and bloating. So just check the labels of what you're eating and see if they have any artificial sweeteners in there, because these generally aren't good for your gut. I'm not saying you need to avoid these foods forever, but in the early stages of GLP-1 use, it can be a good idea to give your gut a bit of a break, and having more simple meals can be a good help. Once your digestive system has adjusted, you really should be reintroducing higher fiber foods to help support your gut microbiome and long-term health. And it also helps with constipation, which I'm going to talk about soon. As I mentioned again earlier with nausea, eating smaller meals more frequently can help, and being consistent with meal times also gives your gut a bit more routine. So try to eat at the same times each day, and this will help regulate digestion. And once again, try to avoid skipping meals if possible. If you skip meals, you're increasing the chance of you having larger meal sizes later on, and your gut may not be quite ready for that increase in volume, especially while you're using a GLP-1. Now again, on the screen, I've put up some red flag symptoms to look out for when it comes to bloating. If you're experiencing any of these, your bloating is becoming a bit concerning, you need to let your doctor or health professionals know. Now, the last side effect that I'll be going through is constipation. About 30 to 40% of GLP-1 users may experience constipation, and it's because, as I mentioned, your whole digestive system slows down as a result of taking these medications, and this includes the movement of waste through your intestines. Now, the good news is that constipation is very manageable with the right approach, and there are also many options that you can find in pharmacies to help as well if you need it. So when things are moving more slowly in your intestines, your body has more time to absorb water from the waste that's in your colon. And this makes stools drier, harder, and more difficult to pass. Add to that the fact that you are probably eating less food overall, which means less bulk and fiber is coming in to help form the stools and push them along. So what's normal and when should you be concerned? Well, it's very normal for your bowel habits to change. You may go from once a day to maybe once every 2 or 3 days. You may also notice that your stools are firmer or even smaller. What isn't normal though is no bowel movements for more than 4 days. If you're straining to pass a stool, you shouldn't have to strain very hard to pass a stool. If you're experiencing these kinds of difficulties, it is worth going to a pharmacy and asking for some over-the-counter help. But prevention is actually key when it comes to constipation, because when you're already blocked up, it makes it harder to manage, and it's obviously a lot more uncomfortable. One of the best ways to avoid constipation or prevent it is making sure you have enough fiber in your diet. But if you have too much fiber too quickly, it can backfire and cause bloating, cramping, and more discomfort. So if you are someone who is not having much fiber already, I'm just going to show you a little 4-week strategy to increase fiber intake. So in the first week, what you want to do is add 1 serving of soluble fiber each day. Something like oats or berries or an apple. In the second week, you want to add another serve to each day. So that could be chia seeds, flaxseed. In week 3, introduce gentle insoluble fiber. And so this is things like well-cooked vegetables or sweet potatoes. And then in the 4th week, if you are still having issues with constipation, then you might want to start thinking about adding a fiber supplement like psyllium husk. Start with just a teaspoon a day and increase it if you need. Now, if you are wondering what the difference between soluble and insoluble fiber is, soluble fibers, they dissolve in water and they form a gel-like substance in your gut. This helps to soften stools and it helps to keep things moving. This type of fiber is also great because it feeds your gut bacteria. Insoluble fiber, it doesn't dissolve in water. Its job is purely to add bulk to your stool, and this helps speed up movement through your intestines. It's very important to know that if you are already constipated, you do not want to take in more insoluble fiber. It can make things worse, which is why, like I said, those first 2 weeks, you're avoiding the insoluble fiber. Now for GLP-1 users, soluble fiber is usually a bit more gentler on your stomach, especially when you're first starting out. Insoluble is still important, but as I said, add it slowly. Now, on the screen, there should be some fiber sources appearing so that you can get an idea of what types of foods you want to be eating. Along with fiber, you do need to make sure that you're staying hydrated. If you increase fiber intake, you also must increase your water intake. This is very important, otherwise you could just make the constipation worse. And just as a tip, sometimes a warm drink, first thing in the morning, I just simply have warm water, can help stimulate bowel activity and keep things regular. Now, the last thing I do want to emphasize is movement and exercise. Even light movement can be a big game changer for your gut movement. My biggest recommendation is to go on a daily walk. This helps with nausea, bloating, and constipation. It doesn't have to be long, even just 15 minutes is okay. So fiber, Water and movement are your best bets for preventing constipation, but if you do end up experiencing constipation and the methods that I've just mentioned aren't working, then you will likely need extra help from things like stool softeners or laxatives, and again, go to a pharmacy or your doctor for that. So that about wraps up what I think you should know about the side effects that may pop up when using GLP-1s, and again, some strategies that you can use to ideally prevent them, but also minimize them. In the next video, we'll be talking a bit more about nutrition, but specifically about the importance of making sure you're getting all the nutrients that your body needs while you have a reduced appetite. So I'll see you in that next video. Until then, keep playing the long game.